Hi, today's health tip is, should you get a flu shot? Hi, I'm Dr. Matt, and today we will be talking about influenza and whether you should get a flu shot or not. We will also discuss the coronavirus outbreak that's going on in China right now in the second half of the video. So let's get to it. The 2020 flu season is upon us, and we're almost to the peak of the flu season. Now you can get the flu any time of the year, but there are more cases between October and April of every year, and the peak is between December and February of every year. The flu comes on very suddenly with fevers, chills, cough, sore throat, muscle aches, joint pains, some fatigue, but you can also develop more severe complications like ear and sinus infections, or bronchitis, pneumonia, and even death. In fact, every year between 12 and 79,000 people die from the flu, and this year so far we've had 8,200 people die from the flu. There are things you can do to help prevent the flu. You can wash your hands with soap and water. You can avoid people who are sick, and if you are sick, you can stay at home and avoid getting others sick. But nothing is as good as getting a vaccine. Vaccinations are recommended for almost everyone older than 6 months. And it can take 10 to 14 days for the vaccine to take full effect. Now for those who are younger than 6 months, they can't receive a vaccine. So the best strategy to help them not get the flu is to have everyone in their family and everyone who comes in close contact with them have the vaccine. The people who are at highest risk for receiving the complications from the flu are those younger than 2 years of age, those older than 65 years of age, and those with chronic diseases like asthma, diabetes, heart and lung diseases, and other immune deficiencies. You can still get sick even if you've been vaccinated, but you're much less likely to get sick, and the disease process will be a lot weaker. You can find out where to get vaccinated at by going to vaccinefinder.org, which I will link to in the description below. There are some medications that work for the flu, but these medications should be started as soon as possible, within the first 2 days to be most effective. And they shorten the course of the disease process by 1 to 2 days. Now there are some side effects. So for instance, Tamiflu, one of the medications, can cause nausea and vomiting, and it can make headaches and psychiatric effects more pronounced. So let's talk about the coronavirus. Now human coronaviruses are very common. They cause disease processes like the common cold. These last just a few days. They're usually an upper respiratory tract infection. They cause almost a third of all the upper respiratory tract infections in adults, and they're common around the world. Symptoms of coronaviruses include runny nose, cough, sore throats, fevers, and a general feeling of not feeling well. Human coronaviruses are spread usually through the air from people coughing or sneezing. They can also be spread by touching an object that has the virus on it, and then touching your mouth or your nose, or shaking hands with someone who has it, and on the rare occasion through fecal contamination. Human viruses, though, can sometimes cause lower respiratory tract infections such as pneumonia, and these can lead towards death. Human coronaviruses can sometimes cause lower respiratory tract infections such as pneumonia that can lead towards death. In fact, in recent times, there have been a couple variants of coronaviruses that have high contagiousness to them and that cause these lower respiratory tract infections and deaths. These are things like the severe acute respiratory syndrome, or SARS, or the Middle Eastern respiratory syndrome coronavirus, or MERS. In December of 2019, there was a cluster of people with pneumonia who were found to have the pneumonia caused by a new type of coronavirus, and this was in China. Now China acted very quickly, and they were able to isolate and sequence the virus, and then they shared that data internationally. They've also quarantined people, and they have built a hospital in just record time to try to help prevent a pandemic. What we know so far about the 2019 coronavirus is that 15 to 20% of people with this virus develop a severe course of disease process. We also know that the need for ventilation support or life support and the fatality rate are a bit lower than SARS and MERS were. Now, you can prevent the transmission of all the coronaviruses by washing your hands with soap and water, by not touching your mouth or nose with unwashed hands, by avoiding those who are sick, and by covering your mouth when you cough or sneeze. Now, if you develop a fever and symptoms of a respiratory tract infection within 14 days of visiting China, you should call up a healthcare professional and let them know about your travel and any close contacts. There is no vaccine to prevent transmission of the coronavirus, but most people get better from human coronaviruses on their own. Now, you can treat some of the symptoms that come with an infection with the coronavirus. So you can use acetaminophen or Tylenol or ibuprofen or Advil to treat like pain or fever. You can use a hot shower or a room humidifier to treat sore throats or cough. You should make sure to drink plenty of fluids, and you can prevent the transmission of the virus by staying home and avoiding close contact with others, and covering your mouth when you cough or sneeze. So that's it. This new coronavirus epidemic that is going on in China right now is something to keep our eye on, but it's not something to panic over just yet. All the cases so far in the United States are directly linked in some way to China, either by someone traveling there or close contact with someone who traveled there. This new coronavirus does not seem to be as deadly as the SARS or MERS. And China, the WHO, the CDC, and governments around the world are all working hard to make sure this does not become a pandemic and that they can limit the extent of this outbreak. In the United States, influenza is the more dangerous virus. The flu is a common contagious disease that has potentially deadly consequences. And these consequences can be prevented through vaccination. When you receive your vaccination, you protect yourself, your family, and those within your community who are at highest risk for these deadly consequences. I have received my influenza shot annually, and it's not too late for you to receive yours this flu season. It's also a good idea to plan for next flu season and to have your next flu shot in October or November. Well, thanks for watching. If you like this video, please like it and subscribe. And if you have a comment, please leave your comment below.